name is Terry Davis, and I live in West Wales, and I work for West Wales Action for Mental Health. It's a mental health charity. My experience of social care stretches back a long way to when I was in my early 20s. At that time, I was diagnosed with what was then called manic depression, which is better known now as bipolar disorder, and that was after a 13-week stay in hospital. And then I was under the care of community mental health teams for many years. I saw at firsthand community-based mental health services at the receiving end of care in that respect, and it was quite an interesting journey, if I can put it that way.
Hello, my name is Kerry Davis, BEM. I'm a lived experience practitioner within disability rights campaigning and consultancy. I was born with cerebral palsy, spina bifida tethered cord and scoliosis, and this means I'll be dependent on others and dependent on social care for the rest of my life. Social care is disabled people's vehicle to survival when you're unable to do basic tasks yourself. It prevents frustration and helps you to live the life you wish to lead.
I think, for me, social care is about equipping you with the necessary tools to be able to not just survive in life, but to thrive in life. So it's not just about meeting your needs, but it's actually about helping you to enjoy your life as well. So it goes beyond just the basic needs, as it were, but hopefully being able to help you with your aspirations and help you to achieve things in spite of living with a longer-term health condition. And it's very sad to see so many people just bumping along, really, and just existing rather than getting the full benefit of their lives, really, and being the person that they might have hoped to have been when they're growing up, really. So I think, support is more than just helping people to stay afloat. Ideally, it's about getting people out of the water into the boat, really.
Social care has helped me become the successful social entrepreneur that I am. It has enabled me to help children smile. Without social care, it just wouldn't be possible for me to do that at all. And without social care, I wouldn't have that smile on my face either.
Adult social care touches people's lives in so many different ways and in such intimate, fundamental circumstances. It's critical to what makes life a good life to lead, about the way we relate to each other as a society. Impact is the new UK Centre for Implementing Evidence in Adult Social Care. It's been funded with £15 million from the ESRC and the Health Foundation, and it's very definitely an implementation centre, not a research centre. So it's about taking evidence that already exists and trying to get it used in practice to make a difference to services and to people's lives. We work across all 4 nations of the UK, trying to be really embedded in those different national contexts, but also sharing lessons across those boundaries. And our definition of evidence is perhaps different to that in other sectors. When we talk about evidence of what works, we mean a mix of insights from different types of research, from the lived experience of people who draw on care and support or who are carers, and from the practice knowledge of people who work in adult social care. And Impact as an opportunity, with the funding it's received, to make a real difference to services and to people's lives. And through Impact, we've got an opportunity to make a practical, positive difference for the long term. Impact believes that good support isn't just about services, it's about having a life. And that's something that we should all aspire to.
Being supported in social care is not just, making sure that you're fed and watered properly or you're given your medication on time. It is about, what can we do to really enhance your life? What can we do to really help you to overcome those barriers so you can break out and lead a meaningful life as well, really? What can we do? We can see you have difficulties in view of the condition and how that affects you, but we're not going to give up on you, because we also know that that everyone has potential, really, and everyone brings something to the table.
Just because someone needs support physically and mentally, it doesn't mean that they can't contribute to society and be valued just as much than their able-bodied peers. There are many fantastic disabled people that we don't hear about within the mainstream media, and I really hope that Impact can help to change that.